Okay, so now that we've talked about how all of the muscle physiology is supposed to work, let's talk about a couple of ways that the physiology and homeostasis of muscles can go wrong. Of course, here I'm talking about muscle pathology. There's two that I want to talk about, and the first is muscular dystrophy. Muscular dystrophy is usually a genetic disease, inherited disease, and it is a defect in the production of the protein dystrophin. The way dystrophin works, if you'll recall, is that it connects the thin filaments, the thin fibers of the sarcomere to the sarcolemma, the cell membrane of the muscle fiber, and through the sarcolemma to the connective tissue of the endomysium. And that's what allows the force of contraction to actually be transferred from the sarcomeres to the cell. Like if you didn't have dystrophin, you would just have all of these sarcomeres contracting and expanding and contracting and expanding and changing shape, but the cell itself wouldn't do anything. You'd be just shuffling around the deck chairs on the Titanic. Nothing would actually affect the structure of the cell. In its most common form, the most common form of muscular dystrophy is called Duchenne muscular dystrophy. It's a sex-linked recessive trait, so it is more frequently found in males than females. What happens is that the dystrophin protein is improperly made, and therefore force is not properly transferred from the contracting sarcomeres to the cell itself and the connective tissue. There are two general results of this. First is muscle weakness. Even though the nerve is strong and the muscle is properly conducting an action potential and all of the muscle fibers are, pulling their little hearts out, and they can be very strong, the force doesn't end up being properly transferred. So you get muscle weakness, right? The muscles are weak. They can't contract very well. At least the muscle itself can't contract very well, even though the sarcomeres are contracting all the time. And the fact that the sarcomeres are always contracting, but that force is not being conveyed to the endomysium, and the cell membrane means that as they're doing this contracting, they're kind of tearing the cell apart. Well, they do it. They do damage to the cell and to the cell membrane as they are contracting. That damage leads to cell death eventually. And as we talked about before, skeletal muscle and cardiac muscle can't really replace themselves. They don't regenerate. So when those muscle cells die, they're replaced with scar tissue. And that scar tissue is non-contractile and it doesn't work. So muscular dystrophy has the effect of weak muscles, little ability to control muscles. Those muscles that do work often don't work very well because you might get some contraction from some muscle fibers, but not all of them, and not acting in unison. Over time, this manifests as destruction and necrosis of the muscle tissue, meaning that the muscles degrade and start to die off, particularly skeletal muscles and cardiac muscles. Both skeletal muscles and cardiac muscles are striated, meaning that they have all of their thick and thin filaments lined up into lines, and they use dystrophin to attach the thin filaments of the sarcomere to the cell membrane and connective tissue. Smooth muscle, if you'll recall, doesn't use dystrophin, and it doesn't use the same sort of method. They don't have Z discs, so they're going to be using dense bodies. So they're not usually affected by muscular dystrophy in the same sort of way. But skeletal and cardiac muscle are. Now, it's unpleasant to live without skeletal muscle, or to live with weak or scarred skeletal muscle. Cardiac muscle never regenerates, and as scar tissue continues to build over time, the cardiac muscle becomes weaker as more and more of it dies and is replaced with scar tissue, and eventually the heart fails. People with Duchenne muscular dystrophy rarely live past 20 years of age, due to, even if you mitigate the effects in most skeletal muscle, the effects on cardiac muscle and on respiratory muscles, particularly the diaphragm, which you just really can't get around using, build up over time progressively, and eventually the patient typically dies. Being a genetic disease, this is incurable, except possibly through gene therapy at a very early age. Gene therapy has not been approved for treatment in muscular dystrophy, though there may be some research going on. I'm not entirely sure about that. Another muscle pathology is called Myasthenia Gravis. That literally means like heavy muscles. Myasthenia gravis is an autoimmune disorder in which antibodies attack the nicotinic acetylcholine receptors in the neuromuscular junction. So these are the ligand-gated ion channels. And so if we have the nerve bulb here, so this is the nerve bulb right here. This is the sarcolemma, and in this area we have these folds going down to increase the surface area. And in these folds we have ligand-gated ion channels. Now remember that the vesicles inside of the nerve are going to be filled with acetylcholine, and when an impulse comes down the nerve, these vesicles fuse and that acetylcholine spills out. It then attaches itself to these ligand-gated ion channels, and that causes the ligand-gated ion channels to open and allow sodium to move in to the cell. That is what causes the electric field, which starts off in one direction, but positive charge is now flowing inside of the cell, so it will flip the other direction, and then that causes the voltage-gated ion channels to open up and allow more sodium to come through, and that's what creates a propagating action potential, right? But all of this is started when acetylcholine binds to the ligand-gated ion channels. If you don't get that starting, then you don't get the initial sodium flowing through, you never flip your electric field, and you never activate the voltage-gated ion channels. So you don't get an action potential, and if you don't get an action potential, then you don't get a muscle contraction. So what happens in myasthenia gravis is that your immune system actually starts destroying the nicotinic acetylcholine receptors, your ligand-gated ion channels. They end up getting destroyed because your immune system starts making antibodies to them, and that tells your body to start destroying them. And then actually, once they start getting destroyed, the muscle cell, in an attempt to save them, will actually pull them into the cell to help protect them. Well, that means that now, when a nerve signal comes down, you get fusion of your secretory vesicles, release of acetylcholine, but you don't have as many receptors, ligand-gated ion channel receptors, in the folds of the neuromuscular junction anymore. So you get less sodium flowing in. That means that a weaker nerve signal or many nerve signals are simply not going to pass the threshold value and will never produce an action potential. Like most autoimmune diseases, myasthenia gravis is progressive. It starts off slow and then it builds. It's most commonly seen in women of early adulthood to middle age, so 20 to 40 years old. Muscle fibers remove these receptors so that they can't be activated or destroyed anymore, and that means that the muscle becomes less responsive. So in terms of symptomology, what you get is muscles, particularly the muscles that have a low threshold to start with, stop responding to that low threshold and become harder to activate. You might activate a few fibers, but the muscle groupings become much less likely to activate under normal nerve stimulation. Usually these effects first appear in the facial muscles because those are where some of the lowest threshold muscle fibers are. And the symptoms are drooping eyelids, so you can't really contract the muscles in your eyelids to keep them up anymore. Double vision, because the muscles that move and focus your eyes don't work properly. And so you'll end up with eyes that are kind of focusing in the wrong places. They're not both looking at the same thing. They're not both focused at the same distance. Difficulty swallowing. The muscles in the back of the throat that control swallowing begin to not be as effective, not be as unified, and the patient can actually choke, potentially dying from that. And progressing to weakness of the limbs, shakiness, inability to walk, inability to maintain posture, things like that. A key symptom is strabismus, which is the inability to fixate on the same point with both eyes, basically leading to a sort of lazy eye-like symptom. So while there aren't really any treatments for muscular dystrophy, there are some effective treatments for myasthenia gravis. If the problem is caused by a lack of acetylcholine receptors, then one way to treat it is to increase the amount of acetylcholine signal. And that can be accomplished with cholinesterase inhibitors. Remember that when acetylcholine Mm-hmm. When acetylcholine is released from the vesicles, you have these proteins called acetylcholine esterase that degrade the acetylcholine very quickly. And what this does is make it so that the ligand-gated ion channels are activated, and then very quickly you stop that activation. And so it stops the nerve from being continuously stimulated. Tetanus toxin actually works by suppressing this acetylcholine esterase, this Pac-Man thing that does that job, and so that means that the nerves are constantly stimulated, and that produces a constant state of muscle contraction or tetanus. That would probably be a little bit overkill for myasthenia gravis, but if you use a weaker cholinesterase inhibitor, then that means that these acetylcholines, they stay around for a little bit longer. So they can actually activate or more efficiently activate those ligand-gated receptors that are still there. And that basically boosts the signal, right? You've taken away some of your receiver, some of your antenna, but you can compensate by boosting the signal. This can allow nerves that would then otherwise be unable to actually get an action potential to fire off, to get that action potential to fire off, thus treating the symptoms. You can treat the disease itself through immunosuppressive agents. The disease is caused by your immune system targeting your own proteins incorrectly. And if you stop your immune system from targeting your proteins incorrectly, they'll come back, as long as you just stop destroying them. This is very effective in that it basically reverses the symptoms of myasthenia gravis, but can be dangerous because there's no way to specifically just stop the immune system from targeting that one protein. Or at least if there is, we don't know it. What we do have is a way to turn down the immune system altogether, usually through immunosuppressants, often steroids, and things like that, so that you're no longer attacking those. But that does make you more vulnerable to diseases, right? If a virus or bacteria does get through your body, well, you have less of an immune system to fight them off. Immunosuppressive agents are like a drug that you would take, so you could theoretically stop taking them and the myasthenia gravis would come back, but your immune system would also come back. A more permanent but similar solution is thymus removal or thymectomy. And the thymus is a very important organ in training the immune system. And so if you get rid of part or all of the thymus, then that will permanently damp down your immune system. This will reduce the overactive immune response that causes myasthenia gravis, but again, will result in you being immunocompromised potentially for the rest of your life. A last treatment option is plasmapheresis. Basically, this is where you would take a large amount of the patient's blood, you would spin it to remove plasma or to remove the harmful antibodies, and then regenerate that plasma with a transfusion from an unaffected person and put the blood back in. So it's basically going through taking the blood out in stages. You don't take the blood out all at once, obviously. You take the blood out, you remove the harmful antibody, and then you put the blood back in. This works, but only temporarily, because your body is still going to be making those antibodies. It's like you've disarmed the immune system temporarily, but you're going to have to go back in for plasmapheresis over and over again because your body's still making those harmful antibodies. You've just sort of removed the stores of them temporarily. All right, so that is what I have to talk about. This is just a little slide showing the symptoms of myasthenia gravis, the droopy eyelid, and the inability to focus both eyes in the same direction. And so that is muscle pathologies.